Is morcellation safe during fibroid removal? Imagine you're considering minimally invasive surgery to remove fibroids, and the idea of quick recovery and less pain sounds appealing. But then you hear about morcellation and wonder if it's safe. Morcellation is a technique that cuts large fibroids or the uterus into smaller pieces so they can be removed through small incisions. It's often used in laparoscopic procedures like myomectomy or hysterectomy and can mean less scarring and faster healing. However, safety depends on several important factors, especially the risk of spreading hidden cancer cells. The main concern with morcellation is the possibility of spreading an undiagnosed cancer called uterine sarcoma, particularly leiomyosarcoma. These are rare tumors that can look like benign fibroids but are actually malignant. If such a tumor is present and morcellation is performed, tiny tissue fragments can be dispersed throughout the abdominal cavity. This can potentially worsen the prognosis by spreading cancer cells, making treatment more complicated. Studies estimate that the chance of an unsuspected uterine sarcoma in women undergoing fibroid surgery is about 0.2 to 0.3%, or roughly 2 out of 1,000 women. While this risk is low, it is not zero. Age plays a role in safety considerations. Women over 50 or those who are postmenopausal are generally advised against morcellation because the risk of uterine sarcoma increases with age. For women seeking to preserve fertility or manage conditions like endometriosis, minimally invasive procedures with morcellation can be beneficial. They often lead to quicker recovery and less surgical trauma. But it's important to weigh the risk of spreading benign tissue fragments, which can implant elsewhere in the abdomen and cause problems like parasitic fibroids or new endometriosis implants. To reduce risks, some surgeons use containment systems like specialized endobags during morcellation. These bags help contain tissue fragments and prevent them from spreading into the abdominal cavity. Early research suggests they can lower the chance of tissue dissemination, but they are still being studied and are not yet standard everywhere. The U.S. Food and Drug Administration has issued warnings about power morcellation, especially in cases where cancer risk is higher, prompting many surgeons to favor open surgeries or alternative techniques to avoid spreading potential malignancies. Deciding whether morcellation is safe for you involves careful evaluation. Your healthcare provider will consider your age, medical history, and whether you have risk factors for uterine cancer. They will also discuss the benefits of minimally invasive surgery, such as less pain and faster recovery, against the small but serious risk of spreading undiagnosed cancer. For women with low risk factors and no suspicion of malignancy, morcellation can be a safe and effective option. But for others, especially older women, alternative approaches may be safer. Ultimately, the decision should be made together with your doctor, who can help you understand the specific risks and benefits based on your individual situation. Preoperative assessments, including imaging and possibly tissue biopsies, can help identify any concerns before surgery. Using containment systems and choosing experienced surgeons also enhance safety. While morcellation offers many advantages, it is not without risks, and understanding these helps ensure you make an informed choice. Remember, always consult your healthcare professional to determine the best approach for your health and fertility goals.